My name is Hasina Outtz Reed. I'm an assistant professor of medicine at Weill Cornell, and I'm going to tell you today about a new project for my group that involves investigating the role of lipid nanoparticles to target the lung lymphatics for drug delivery. So I'm primarily interested in the lung lymphatic vasculature and how these vessels contribute to and the pathogenesis of lung disease. And I want to just take a step back and discuss the lymphatics in normal lung biology. So the lymphatics in the lungs drain fluid and traffic immune cells from the distal lung parenchyma more centrally towards the mediastinal and hilar lymph nodes. And in the lungs, there's really two places where the lymphatics are found. So running along this bronchovascular bundle in close association with the airways and the major arteries. And then there's other lung lymphatics that are found farther out in the lung parenchyma. So lymphangiomatosis and lymphatic malformations occur with very profound consequences in a variety of diseases, and of course have been the subject of many talks in this conference. So for example, on the left, this is an MR from a patient with KLA with these very abnormal lung lymphatics, which you can see here, and similar findings can be seen in other diseases with lymphatic malformations, often associated with poor prognosis. In addition, abnormal lymphatics can be seen in more common chronic lung diseases, including COPD and asthma. So being able to specifically target the lung lymphatics is likely a very worthwhile endeavor for a variety of diseases. And it's possible that potentially being able to treat the lung lymphatics specifically would not only allow for sort of local delivery of drug to these areas, but potentially boost the amount of therapy that could be found in the lungs when given in addition to systemic therapies. So for example, potentially you could use inhaled rapamycin to treat lymphatic anomalies as well as systemic rapamycin to boost the levels that are found in the lungs. So the project that I want to talk about today is how can we do this? How can we target the lung lymphatics specifically for drug delivery? And one of the ways that you can think about doing this is to use nanoparticles to package drug and then design it as such that it could be inhaled and localized to the lung lymphatics. And nanoparticles in general, whether they be inhaled or systemically injected, come in many forms, and lipid nanoparticles in particular are gaining a lot of traction of late. Of course, most recently coming to light is the carriers for the mRNA vaccines for COVID-19. And there's actually several formulations of lipid-based nanoparticles that have been used for a variety of purposes, ranging from liposomes, which have a phospholipid bilayer and an aqueous core, to emulsosomes, and then along the continuum of lipid nanoparticles, there's various formulations that have varying lipid contents, and these lipid nanoparticles for drug delivery potentially could be used in an inhaled fashion to target the lungs. But when thinking about this, it's important to remember the unique characteristics of the lungs that may affect whether and how these particles could be used effectively. So one of the things that we know is that the size of the particle very much determines where it lands on the bronchial tree after it gets inhaled. So only very small particles will actually make their way down to the alveoli and be able to cross the epithelial barrier to get into the lungs itself. And even after this happens, it's very interesting to think about sort of the fate of something after it gets inhaled. So in general, as you know, the lungs are sort of designed to be able to inhale things and then end up in the circulation. And this is because you have the alveoli, the sacs of the lungs are surrounded by the capillary bed to allow for uptake of inhaled items across the epithelium into the blood circulation. But it's also possible that some things that are inhaled don't end up in the circulation, and they actually pass over through the sacs, through the alveoli, and end up in the lung interstitium. And once there, these items can then, or these particles can then be drained into the lymphatic vessels that sort of surround the alveolar structures and the major airways in the lung. And in fact, the role of the lymphatics is very much sort of the drainage pipe of the interstitium. So designing molecules that could be targeted to the lymphatics could potentially lead to their preferential uptake into the lymphatic vessels and not into the blood circulation. So how could we do this? So there's actually been a fair amount of work in this area. So we know that size, the surface charge, the lipid content very much determine the ability of various nanoparticles to sort of localize specifically to the lymphatics. And in addition, you can make modifications to their surfaces to target these particles to various areas. So using many different modifications, you can do this. In particular, lectins are ones that I want to draw your attention to. And when I was kind of thinking about this project, I actually reached out to Dan Heller, who's at Memorial Sloan Kettering, and his lab is very much focused on the design and development of nanoparticles to deliver drugs. And he's actually focused on cancer therapeutics and delivery of nanoparticles for cancer treatments. And one of the things they've more recently been focused on is using endothelial cell targeted lipid particles. And the things that they're trying to target with their nanoparticles are actually called galectins. And when I was speaking with Dan, I became very interested in this because the galectins are a highly conserved family of lectin molecules. There's actually 16 that have been identified to date. They're sort of grouped according to their arrangement and number of these carbohydrate recognition domains that they have. And using those carbohydrate recognition domains, they actually can bind to glycans present in other proteins, other lipids, other molecules. They've been implicated in a variety of biological processes, including like cell cycle and cell growth. And there's also several galectins, including galectin 1 and 3, which are localized on the cell membrane and actually can interact with the extracellular matrix. There's been some recent interest in the galectins in endothelial cell function, and actually several of the galectins are implicated in endothelial cell proliferation, activation, and tube formation. But particularly interestingly for me, there's some evidence that specifically galectin 1 and 3 are particularly important for lymphatic vascular function. And in fact, galectins 1 and 3 have been shown to be important for entry of immune cells into the lymphatic endothelial vasculature. So with this in mind, I was actually just curious about the localization of galectins in the lungs. So I did some immunohistochemical staining just using mouse lungs, and then also did staining for the lymphatics. So the lymphatics here are shown in red with the marker VEGFR3. Galectin 1 is shown in green. And you can see in the mouse lung this very sort of robust staining pattern in general, but it also seems to be fairly well localized to the bronchovascular bundle. So right sort of surrounding the airway and surrounding this large blood vessel. And looking at a higher mag pic, you can see that the lymphatic vasculature, just as I mentioned before, run right in that bronchovascular bundle and therefore are kind of circumscribed by the galectin 1. And in this picture, you can really see how robust the concentration of the galectin 1 is around that lymphatic vessel. So, you can imagine that it's possible that if you design not only a lipid nanoparticle that could be targeted to the lymphatics, but one that's targeted to the galectins, perhaps when given in an inhaled form, this could be useful for targeting the lung lymphatics. So Dan and his lab had actually made a lipid nanoparticle that is targeted towards galectin 1 and 3. And this lipid nanoparticle could be used to house various therapeutics, particularly and target the lung lymphatics when given in an inhaled form. So we decided to actually go forward and see if these could potentially be useful in our system. And on the left is some EM of the particles themselves. You can see that they're very small, about 30 nanometers. And in fact, in various binding assays, they do show very robust binding and targeting to galectin 1. So this is actually just a very simple assay where you have increasing amounts of the galectin-targeted lipid that's in a solution of galectin 1. And you can see that with increasing amounts of the binding lipid, you see decreasing amounts of free galectin in the solution, really demonstrating how well targeted this lipid particle is. So using lymphatic reporter mice, so this is the PROX1 GFP mice where the lymphatics are in green, we just gave the galectin-targeted lipid nanoparticles in an inhaled fashion to these mice. We labeled the particles with rhodamine just as a fluorescent label so we could see it later. And we actually saw very nice localization of the particles directly in the lymphatic vessels in the lungs. And this actually, we tested many different formulations and this wasn't always true. So this is actually also using a galectin-targeted nanoparticle, but using using decreased lipid content in a larger size. So this is actually an increase of 150 nanometer size nanoparticle. You don't see that localization to the lung lymphatics, and it almost just seems sort of stuck out here in the lung parenchyma. You get a similar pattern when you use an untargeted nanoparticle. So this is just an emulsosome or a conventional liposome with the rhodamine labeled nanoparticles. You just see them out in the lung parenchyma, but you really just don't see that localization to the lymphatic vasculature. So it seems like this, this is a very qualitative way to look at this, but we wanted to really see, could we see drainage of our lipid nanoparticles through the lung lymphatics after they were inhaled to the draining lymph nodes? So we again used the labeled particles. We delivered them by intratracheal methods into the lungs of these mice, and we found that the Galectin-targeted small lipid nanoparticles, indeed within an hour, we could see them draining to the thoracic lymph nodes. This was actually not true of the inguinal lymph nodes. When you give them in an inhaled fashion, at least at this early time point, they're mostly located in the thoracic lymph nodes. They have not made their way into throughout the lymphatic system, so you couldn't detect them in the inguinal lymph nodes, although it's likely that with time this would occur. And then even more, we really didn't see systemic localization of these nanoparticles. So just looking at the urine of these mice after we gave the particle in an inhaled fashion, we couldn't detect the fluorescence in the urine of the mice within 1 hour, or even 4 hours after giving the particles in an inhaled fashion. And this is in contrast to if we gave the particles systemically, right? So if we just injected it into the veins via retroorbital injection, you within an hour, and even actually at earlier time points, can immediately see these nanoparticles in the systemic circulation. So these very early data really seem to suggest that the inhaled galectin-targeted lipid nanoparticles seem to stay at least within the lymphatic system, and particularly within the thoracic lymph nodes draining the lungs. So we're going to be working on continuing to investigate the biodistribution of these particles, and our ongoing studies will investigate the extent to which they sort of localize differently when given inhaled or systemically. But we also want to be able to test their ability to really alter disease and alter the lung lymphatics. So I'll just introduce you to the mouse model that we'll be using for that. So this is mice where we will induce expression VEGFC using a VEGFC gain-of-function allele with a lung-specific promoter, the SPC-CRE. When we give that mouse tamoxifen, we'll then wait a month to harvest the tissue. You can see that we get robust upregulation of VEGFC, whereas VEGF-A is not affected. And these mice really get a very impressive amount of lymphangiogenesis in the lungs, which you can see here by staining, that in fact completely alters the histology of the lung, sort of obliterating a lot of the normal lung structures. And you can actually also see active sprouting of these lymphatic vessels in these mice in the lungs compared to the sort of more quiescent lung lymphatics in the controls. So just in summary, we're sort of investigating these novel inhaled lipid nanoparticles for delivery of therapeutics, so lung lymphatics, specifically using glycosphingolipids targeting the galectins. And our ongoing studies will really be to assess the efficacy of these galectin-targeted particles for lung lymphatic abnormalities. So I'll stop there. I just want to thank my collaborators who I really work hand in hand with and have the most expertise sort of developing these particles, Dan Heller and Emma Grabarnik and at the Memorial Sloan Kettering, all of my collaborators and mentors at Weill Cornell. I also have put my email here in case there's any questions, and of course we're sort of actively expanding the lab, so if this work interests you, so please feel free to reach out. And with that, I'll take questions.